Dear students, welcome back. In this session, we are going to discuss about what do you mean by pain and what are the factors in influencing the experience of pain and what are its characteristics and reactions of pain and also the types of pain, that is acute and chronic pain, and some of the theories related to the pain. Okay, now what do you mean by pain? Pain may be defined as a state of sensory or emotional experience. That sensory is also an unpleasant sensory and emotional experience which may result from actual or potential tissue damaging stimuli. Okay, this is the definition. And if you see the characteristics of the pain, if the intensity of the stimulus is below threshold, pain will not be felt. As the intensity increases, more and more pain is felt. Okay, so pain receptors show no adaptation. So pain continues as long as receptors continues to be stimulated. And if you see the localization of pain, superficial pain is better localized than deep pain. Pain sensations are always accompanied by emotions. If the rate of tissue injury is high, the intensity of the pain will be high. These are the characteristics of pain. If you see the reactions of pain, in these reactions, first one is the behavioral reactions. That means the person will show some expressions like crying, moaning, frustration, mental irritation or depression, like that. Some of the behavioral reactions we can see due to pain. If you see some muscular reactions, spasm of skeletal muscles in the affected region can be seen. And next one is the changes in autonomic nervous system. Pain is accompanied by signs of sympathetic overactivity. For example, there may be a rise in BP, okay, and tachycardia, increase in heart rate, okay, tachycardia, and also pupillary dilatation can be seen. If the pain is increased, such kind of sympathetic overactivity can be seen. And next one is the reflex response. A painful stimulus will be always associated with somatic reflexes. For example, pinprick in the sole of foot leads to the withdrawal of foot, or if you touch any hot object, so then which leads to withdrawal of your finger, like that. So these are the reflex responses and these are the reactions of the pain. Now we will see actually there are some of the clinical models of pain are present, like acute pain and chronic pain. And next one is the visceral pain, which is also called as somatogenic pain, radiating pain or referred pain, psychogenic pain or neuropathic pain. So these are the four different types of pains. Okay, and also what are the factors which influence the experience of pain? One is the nociception, that means painful stimulus, and any social factors, maybe social well-being. It is related to the social well-being, that is social status, which also influence the experience of pain, and also the cultural factors and psychological factors. The psychological factors which may there are plenty of reasons are there. So you people may already studied under in psychology subject. Okay, so you can apply all those things here. And next one, we'll see the clinical models of pain. In that, the first one we are going to discuss about pain is the acute pain. Yes, acute pain. So this acute pain is of recent, that means very starting stage of the pain, recent or sudden onset with demonstrable etiology. That means we'll know the cause for that and limited course. Function of acute pain. Is it a good thing or bad thing? Means acute pain actually causes an alertness to the individual to actual or potential tissue damage so that appropriate measures may be taken, that is the withdrawal from the stimulus to prevent further injury. How it takes place now we will see here in this flow chart. For example, any noxious potential damaging stimulus, so that means which causes stimulation of the nociceptors. So if your tissue is damaged, some chemicals are produced. Those chemicals are recognized by this nociceptors, and this one is carried out by A delta and C fibers, which enters into the dorsal horn, and if it has to take in reflex action, then it is not sent to the higher centers. So in the spinal cord itself, again it will go to the ventral horn, where with the help of interneurons it forms the synapses with the motor neurons. So then what happens? So it causes reflex response in the skeletal muscle contraction to escape stimulus muscle spasm. Okay. And what are the other ways? Or one is the sympathetic preganglionic pool, which also causes reflex responses in the peripheral vascular system or other visceral or origin. Okay. And if the same sensation or the stimulus reaches to the higher centers, then we can appreciate the pain perception. Okay, so what kind of pain it is? Okay, so in this ways, this pain, this acute pain gives an alertness to the individual. Okay, so this is about the acute pain. Actually, the acute pain is very intense. Why? Because here the signs and symptoms of inflammation are very strongly perceived by the subject. Okay, in the case of acute pain, that means if any injury is caused, so in that region, because of this chemicals which are formed due to injury, which always stimulating the nociceptors. So the pain felt by that person in the case of acute pain is severe. Okay. Now we'll see chronic pain. Chronic pain is defined as the pain that persists for at least 3 to 6 months beyond initial cause and after healing is presumed to have happened. That means pain of long duration, which is typically the original pathology is healed. So the symptom pathology relationship is not as straightforward as before. Okay, that means if you have a instant injury or sudden injury, which also causes increase in the intense pain in the case of acute. But here it is not found like that. In the case of chronic pain, actually the original pathology is healed. That means the injured part is healed. Still, the person is having some pain sensation which is uh, felt by the person. Okay, normally such a kind of pain of long duration, the person often associated with some suffering, anxiety, or fear that something bad or unpleasant will happen, and also the person is having depression or hopelessness. Okay, so in this condition, the signs and symptoms of inflammation are considerably less, and the subject feels mild pain in certain activities. If we see the causes of chronic pain, which increase the sensitivity of the nociceptors. Okay, and so once the receptors are stimulated, what will happen? So the peripheral nerve is also gets such kind of stimulation, that is called as a long lasting peripheral nerve compression, which leads to the destruction of large primary afferent neuron. As a result, there is an imbalance of large tactile and small pain fiber input occurs, thereby keeping the gate open for the pain. So that means here the application, you can see the flow chart. So application of stimulus that activates A delta and C primary afferents, which leads to the perception of noxious stimuli, which causes negative affective responses, that is imbalance will be happening here, and then which leads to pain behavior due to activation of pain perception and also the stress anxiety. Okay, this is about chronic pain. Now we will see the theories of pain. Okay, so there are different kinds of theories has been proposed from 18th century itself. Okay, and so we will see the most important theories of pain. One is specificity theory of pain, pattern theory of pain, and summation theory of pain. Okay, if you see the specificity theory of pain, what will happen here? So actually this theory was proposed by Von Frey in 1895. Von Frey in 1895. He explained that receptors will be specific to particular type of sensory experience. So that means pain receptors are separate. That means if it is a crude pain or pinpointed pain, touch, heat, like that. So he proposed that there are different kinds of receptors will be specific to particular type of sensory experience. That is the thing seen in the specificity theory of pain. If you see the pattern theory, this was proposed by John Paul Neff in 1929. So in this theory, he suggests that the nerves involved in detecting pain, the nerves involved in detecting pain also detect other sensations. So this theory mentioned that the nerves which are involved in detecting pain also detect other sensations. According to this pattern theory, there are no specific nerve fibers or endings used just for the sensation of pain, but different sensations such as cold, pain, heat and touch are detected by the same nerves, which is then sent to the brain in specific signal patterns. So the brain interprets the pattern, which includes both the sensation and intensity and the specific sensations of these stimulus. Okay. Yes. So this is about the pattern theory. Okay. So that means here the brain interprets the patterns. So that means the intensity, how much intensity of the sensation is carried to the brain. It was sending that impulses in a pattern type. Okay, so because of that pattern type, so how much pressure is obtained and how much time the pressure is obtained. So by taking these two things, the brain interpret that pattern. So if it is applying for a longer time, so it is somewhat cold, or if it is applied, for example, pin pricking. So in the case of pin pricking, so we will feel intense pain within a second itself, isn't it? So such one, so that in that the pressure applied and also the time involved for that sensation is one type of pattern. That pattern is recognized by the brain and perceive that it was pinprick. Like that, the pattern theory of pain was explained. And next one is the summation theory. Okay, actually the summation theory was proposed by Livingstone in 1943. And before this summation theory, this Livingstone summation theory is called as central summation theory. Earlier, intensive summation theory was proposed by Ubb in 1874, which is built on Aristotle concept. Pain resulted from the excessive stimulation of sense of touch. So, and also in that intensive summation theory describes both stimulus intensity and central summation as clinical determinants of pain. So that one is the very earlier theory called as intensive summation theory. But in 1943, the theory is called as central summation theory, which was proposed by Livingstone, and he gave the information that intense stimulation resulting from nerve and tissue damage activate fibers that project into interneuronal pools within the spinal cord. So this is the findings found by the central summation theory. Okay, so here not findings, we can say these are the things, these are the idea which was given by this Livingstone in the central summation theory. So in the next session we are going to discuss about the pain gate mechanism. Thank you.